Dialysis is a mechanical way of cleaning the blood. The blood is pumped into a machine, and the machine has a very high-tech type of filter, and it takes out all of the waste in the blood, and then it puts the blood back into your body and it's clean. There are a couple of kinds of dialysis. One is hemodialysis, which is done through some access, usually in your arm. They put a shunt between your vein and your artery, and then that's where they put the needle in when you go to the outpatient facility. Some people get peritoneal dialysis, which is done through the abdomen. But either way, it's a pretty effective way of getting your blood clean. There are doctors that specialize in kidney medicine, kidney disease, and they are called nephrologists. And they decide how frequently you're going to have dialysis, how long it's going to be. They're going to monitor all of your electrolytes and the minerals in your body and your blood pressure and your heart. So they manage the dialysis. But dialysis itself, the actual procedure, that's typically done by nurses who specialize in dialysis and then technicians who also specialize in dialysis. They're trained to do this. Well, there's a number of things that go wrong. As you can imagine, dialysis is complicated. It's a complicated piece of machinery, and it's complicated medicine. People that do it every day and who are trained properly, they know how to do it and they get a good outcome. Some of the things that go wrong are patients can get infections, they can become very sick from that, they can become septic, and if that's not controlled, then that can kill them. There are things in the dialysis machine. You must have sterile water, and sometimes the machine, you must maintain that water perfectly clean. Other things that go wrong is they can be overloaded with fluid and go into heart failure. If the electrolytes get out of balance, they can have a heart attack. They can have what's known as a cardiac arrhythmia. There are other things that go wrong as well, but those are some of the most common. If you don't have a backup generator and the power goes out, the machine stops and the patient's blood is actually in the machine just during that time. Well, somebody has to get the blood back to the patient, and that means that you have to do a procedure called hand cranking. While hand cranking works, it requires special training. It requires that the nurses and the technicians all learn how to do that procedure and do it properly. If you don't do it properly, well, it could cause death. I think that if there is a case, I would recommend that they call LawMD and look to see if one of the lawyers who's a doctor is located near them. And I would contact them and ask them if they would look at the case, and they'll do that. I can't think of anybody better than someone at LawMD that could do that for them.